Hi everyone. I know it's been a while and I just wanted to do a little catch up. Sorry for leaving everybody hanging, everybody who's actually interested, leaving everybody hanging. So, let's see, a lot has happened. So I had the radical debulking surgery on my right thigh. Um, I have pictures. I don't know that I'll put them up, or at least not in this video, mainly because they're pretty gross. I would say graphic as well, but they might be a little hard for some people to look at. But in the reality of things, if anybody is thinking about doing it, it might be helpful. What I can say about the surgery is I was originally told that it would be 2 weeks and then I would be back to work. Didn't quite work like that. The surgery itself, it was supposed to be one night for observation. I stayed for two, mainly because, my reasoning was because I have stairs to navigate once I'm home. In addition to that, there were, a couple of little mess ups at the hospital. One being with the drain. So they put the drain in. I don't know if these pop-ups are bothering you. I keep getting an alert. So they put one drain, in your calf on the inner, because it was my right leg inner part. I imagine it's the same thing on the left. So it's on the inner part of your calf up towards the knee. And what they actually do is they go in through, well, I say go in, they come down, and then at the inner part of the back of your knee, they open it up, I guess, and they put the drain in. So anyway, the drain was put in, but it wasn't stitched in, and apparently you should have a stitch just to hold it tighter. It wasn't stitched in for whatever their reasoning was, but it was bandaged somewhere. I don't remember exactly. It wasn't over the whole drain. And so originally the drain was filling, and it was just some things. The hospital is fantastic, but was my stay fantastic? Not in the beginning. Towards the end, it got great, but the first day / night, it wasn't good. When you have a nurse that's an asshole, for lack of a better word, and also the personal care assistant, who kind of joined in with her, that they were both assholes. I imagine that they worked together on a shift, and either they're used to treating people however they want, or they're accustomed to getting some, back and forth with the patient. Because I had issues with them, and I'm not really going to get into them right now, but I am a pretty wonderful patient. And what I mean by that is I go with the flow. I work with it. I understand what I'm getting myself into as far as pain or, whatever discomfort, whatever it might be. I know this ahead of time. And I also know that nurses and personal care assistants, they can be overwhelmed with the stuff that's going on with other patients. So I'm the last one to ring a bell. I'm the last one to ask for something that I either can't get myself or can't get, someone who's visiting me to help me out with. So for the most part, I'm a trooper, and I'm not saying that to be wonderful. I just really am. I really don't try to, this another pop-up. I really don't try to, overwork the nurses, because I do understand. Anyway, so day one was miserable. But a physical therapist had come in towards the end of the day for me to walk. And so it was basically walk in the hallway, then walk down the stairs, a couple of stairs, up and then down. Now, the thing is, when you're on Oxy, not to say you can basically do anything, but I had no pain. So I could walk, kind of stiffly, but not with the pain that you would anticipate after, basically being filleted and then put back together. So anyway, so what she had done was she had taken the drain and pinned it to my gown so that I wouldn't have to hold it basically. And this way my hands would be freed up because I was using the walker, I guess, for their own, insurance purposes. They make sure that you do that, which was fine with me because I think it really helped me. So anyway, so she had pinned it to my gown. I get back in the bed, and the surgeons, two other doctors who worked with him, I want to say that they were probably residents. But anyway, so they had come in and checked everything and, blah, blah. And the drain, part of the problem was that this nurse and this personal care assistant, might not have been his problem, but they hadn't changed the drain either. So it was very full with blood and stuff. And so anyway, at some point, the drain, because it wasn't stitched, the drain came out. Now, what I think, well, almost came out. What I think was when I had the nurse, actually when it came out fully or relatively close to the end, had this nurse the next day. He was fantastic. If I tell you he was the best nurse ever, he was pretty much the best nurse ever. Fantastic. And but when he came in, he saw how long the drain was. And he said, you know what, let's, like I had something to do with it. Let's clip the drain, make it shorter, put the bulb back on, and it should be better. I wasn't complaining, but, in his mind, I guess it was a good idea. So he did that. But I think that the movement, I won't even say tugging, but just the different ways that he was moving the tube around in order to cut it, I think that had something to do with it. But what also happened was when he reconnected it, there was no real suction. The bulb would not suck tight again. It just kept being like an open bulb, sort of think of like a hand grenade as opposed to a donut, right? Like instead of being closed. So once that happens, there's no suction, nothing is going to be basically pulled out. You're only going to get whatever drips. So when my surgeon came back in, no, I'm sorry. When the two other doctors came back in, they went and reported to the surgeon that it really wasn't connected. So then they came back and they disconnected it. Problem is, you're supposed to have the drain for at least a week. So now my concern, what's happening, like, am I going to get some kind of infection? And then the surgeon, when he came to do his rounds, he said, I really would have liked it to stay in for at least a week. Well, that doesn't make me feel good. But at the same time, I'm sure that it was impossible to put back in. So basically they patched it up with some gauze and that bandage that, it's like it goes over the gauze. And that was it. And so I was supposed to change it like in a day or so, which I absolutely did. And then at some point, like I kept changing it, but at some point I knew it's, time to not keep covering it. So anyway, so I was supposed to go back to the surgeon in 2 weeks to get checked out. I think normally he would make somebody come back the day after or 2 days after. But since I stayed in the hospital the extra day, I guess he, saw enough that I didn't have to come back until 2 weeks. Well, after the first week, when I tell you suffer, I really suffered. And the reason I suffered was because in addition to the the stitches, I also had blisters. When I tell you blisters, I'm talking about enormous, like big blisters. So the first blister had gotten so big and it wasn't like looking very nice, you know, like color wise and everything. So between the pain and the blister, I made like an emergency appointment to go see him. Now the thing is, because of the way things were, I couldn't wear pants, and I couldn't wear pants, and I didn't have anything really protecting my leg at all. And of course, by that time, the oxy was finished. I think it was maybe 2 days or something, which I was fine with for the most part, because I understand their whole point. You know, people get addicted. And I mean, I don't have an addictive personality, but they can't take chances, and I understand that. So now here I am, a week into this surgery with basically nothing. I mean, I took some Tylenol, and P.S., I had some Tramadol because I'm prescribed that anyway. And I hadn't been taking it for quite some time, but since I had it, I took a Tramadol here and there. And it helped. It didn't help that much, but it helped. So anyway, so this day I go to see him. It's like literally a week later, and he does what he has to do for that blister. It was like a thing, you know. He had to slice it and drain it and all this other crap. And so then he says to his PA that he wanted me wrapped in the ACE bandaging, basically from foot to thigh. So the thing that bothered me is I was thinking I probably should have been wrapped from the beginning, right? But when I was discharged, he wasn't there, and there was no mention made about ACE bandaging. But I have a feeling that that really should have happened, because as soon as he saw me a week later. So the thing that kind of bothered me was, had I not gone until the 2-week appointment that I had originally, I would have been 2 weeks out without the ACE bandaging. So anyway, oh, my daughter's gonna call. So anyway, so I had the ACE bandaging done, and I had the ACE bandaging done, and I went home, and I was having a horrible time because what started happening. And he also put some. He replaced some of the butterfly bandages, or where he saw parts of the incisions that. Now the incision goes pretty far. The incision goes. They call it a Y incision, but it basically goes from. Think like a tree branch. It goes kind of like, oh, come on, it's my daughter, I'm sorry. And so it basically goes from both sides of the groin, right? And it comes down, and then it kind of makes, I would say, like an S. And then, like I said, it has that piece behind the knee. So yeah, so it's a interesting configuration. Well, anyway, so what was happening, he replaced some of the bandaging from bandages that had already, butterfly bandages that had already gotten crappy. And so he replaced some of those, and he added a few where he saw that the incision needed a little bit more support. And so I went home, and things got progressively worse within the next day or so. What happened was the whole inner part of my thigh became so inflamed and hot. It wasn't really like that when I saw him, but all of a sudden this happened. It had nothing to do with the bandaging. But when I tell you how hot and how red, and the bizarre thing was, basically you could draw a line between the part that had the surgery and the part that didn't, right? So like the right side of my right leg hadn't gotten, touched at all. So that was a regular color of my skin. And then the inner part on the left side of my right thigh was so red and so hot. So I got concerned, and then what started happening was blisters were showing up everywhere. And these blisters, again, they weren't as big as that first initial blister, but they were, I'm trying to think of something to compare it to. The first one was like the size of half an egg, right? If you did it oblong. The other ones were the size of, I don't know, I can't think of something. They were bigger than marbles, right? But they were popping up everywhere. And one of the problems was you had to sleep on your back, basically, while this was healing or whatever. And so there was like a pressure point in the middle of my thigh where the blisters were also popping up. So the area that it was really painful because the skin where the blisters were was being pressed on it. Anyway, it was a very uncomfortable situation. So I had all these blisters. So I called the doctor's office, and the PA basically said, just cover it with some Vaseline and, put a bandage on it. And then, of course, you have to still rewrap it with the ACE bandage. And I think that the ACE bandage was the culprit to what aggravated everything to begin with. So I did that, and it really didn't help. And the blisters were there. And the thing is that the blisters stuck around for a while, a good while. And the ones that were underneath my leg became sore, not like bed sores, but sore, where they eventually had to scab up or dry up. But they were very painful, I would say. Maybe more painful than the incision, okay? And then what happened? So anyway, so the stitches were basically dissolvable stitches. When I went to him the first week? No. When I went to him for the second appointment, which was 2 weeks after that, he had to remove a couple of the stitches because they hadn't dissolved. And the one of them that was on right where the Y would meet, my daughter again, right where the Y would meet up towards the groin, it would hurt so bad if I moved a certain kind of way. Well, it turns out that the stitch, not only hadn't it dissolved, but it was kind of pulling when I'd move. And because it was pulling, it, of course, hurt, but it hadn't dissolved. So he took care of that one. And so then I went home, again, bandaged and whatever. And the only real pain, I was a trooper, believe me. I didn't cry the whole time, even though I probably really wanted to. But I kept telling myself, elective surgery, you chose to go through with it just because he said that I should do it. My quality of life would be better. He gave me all of these reasons. But my mistake was when I went to him, I thought I was going to a vascular doctor, right? And I went because I was having this pain behind my left knee. And I had read that if you have this issue with one of the veins behind your left knee, it's dangerous because that vein goes to your heart somehow, and it's a big deal, big deal. So that was enough to make me go to the doctor. So I went to the vascular surgeon that a family member of mine already used. I'm almost up to 20 minutes. I'm sorry. And so anyway, I went there, and I didn't realize that he was a vascular surgeon. So when I told him about the pain in my left knee, he pretty much blew it off real fast. And he was like, there's nothing I can do for that. He took the Doppler just to satisfy me that it wasn't a blood clot. And with that, he jumped right over to telling me about what he could do for this leg. Now, trust me, and he said at the time, I have lymphedema and lipedema. And neither one of those are a surprise to me because I've researched enough things on Google to know that that's exactly Google and really YouTube, that I know that that's what it was anyway. And it's been years and years in the making that this leg is larger than the other. I think I'm going to cut this because 20 minutes is way more than enough. I'll make another video. I'm just going to call my daughter back since she keeps popping up on the screen. And I will then continue my recording, okay?